Yes, some people in the comment section chatted me, asked, how do they know the timing? That's very simple. Remember, what we are doing here does not prevent you from seeing your doctor, but it's just an addendum. It's more like a supplementary, piece of advice or help, so that your consultation with your doctor will be brief. So now, the timing is very simple. Remember, the last video we talked about the timing and regularity. So now, I want to expand on that timing. Now, I told you in the last video that in a menstrual cycle is just beginning of one menses to the beginning of next menses. There's something you need to understand. The beginning, that is the day blood start coming out, that's your period now, that is the beginning of another cycle. It is the beginning of another cycle. So some women think that is when the blood stop coming out. No, the first day it comes out is the beginning of another cycle. So now, like I told you, the menstrual cycle is from one menses to another menses. In the last video, I said that yes, the distance between one menses and the other should not be less than 21 days and should not be more than 35 days. That's very simple. That is one. Then number two, I said that there are two main phases. And that cycle is divided into two. We have what we call the follicular stage and we have what we call the luteal phase. The follicular stage is from the day blood start coming out till you have your ovulation, which is normally at the middle of the cycle. Then the luteal phase is from the middle of the cycle. That's when you have your ovulation till you have the next menses. Now let's talk about the follicular stage. Follicular stage, as the name sounds, is the time the follicles are gathered and a hormone released by the anterior pituitary called follicle stimulating hormone, FSH in short form, is released. That FSH will start acting on them, start nourishing them, start building them, start training them. Now, at the end of the day, one or two will survive, others will go down. I may not go into the theory of how that one happens, but at the end, out of about 15 to 20 follicles that will be acted upon by the follicle stimulating hormone FSH, one survives. That one is called dominant follicle. I will still talk about there are times you can have two surviving, but now let's talk about the dominant follicle. The dominant follicle is the one that is going to be released on the day of ovulation. That is the middle of the cycle. Now, you have heard about the follicular stage, the time the follicles grow, they are prepared to mature. Then on maturation, at the end, what will now happen is that they are released on the day of ovulation. That one that is released is called the mature follicle or the dominant follicle. Now, when the dominant follicle is released, that is the egg now. The follicle has released it. Now, at the end of the day, the egg now can now be fertilized by sperm. That's why I told you. Then, at the end of the day, between the ovulation time to the next menses, we call it the luteal phase. That luteal phase is also called progestational stage. That is the time when progesterone will start acting. At that time, the body is assumed that this woman will get pregnant. So the body doesn't want to be taken unawares. The body will start preparing. At that point, you see some pregnancy changes in the body of the woman. Some people can complain that their breasts get enlarged. Some people can complain of more like a cramping in their pelvic region. You understand? That's the location of the womb. Then they can complain of all sorts of things, pertaining to pregnancy, because the body is preparing you for pregnancy, assuming that the egg that was released on ovulation has been fertilized. So while that one is going on, you find out that the whole thing, there are many things happening at that time. The estrogen will be acting on the endometrium of the uterus, that is in the inside lining of the uterus, trying to prepare it to receive the baby. So many things acting. So at the end of the day, if the body does not discover that there is no pregnancy, what they will do, that is now the reason for the next menses. All those lining that were aligned in the inside of the womb, that is what we call endometrium. No, at that point they will wash away. That washing away is that blood you see. So now, why is this knowledge important for our fertility class? Is because that you need to understand. Remember what I told you. We normally use 28-day cycle as an ideal cycle, but that does not mean that if you don't have 28-day cycle that you're an abnormal woman. We just use it for our calculation, because when we divide the cycle into follicular stage, we have 14 days. We have the progestational stage or the luteal phase, we have another 14 days. Now, this is why the timing is important. The luteal phase is constant for every woman. So from the ovulation till the next menses is 14 days. Nothing is fixed. Now, but the follicular stage is not fixed. It depends on your menstrual cycle, the cycle length. Like for instance, somebody that is having 28-day cycle, you find that when you remove 14 here, the one that is constant, which is the luteal phase, the follicular stage will remain 14 days. So you now see that on the 14th day, that's when you have ovulation. So now, for a woman that runs 27-day cycle, let's use the example. 27-day cycle, you must remove the 14 days of the luteal phase. What is remaining for the follicular stage? You see, the follicular stage will not be what? It's going to be 13 days. For a woman that runs 26-day cycle, it's still the same formula. Remove 14 days for your luteal phase. What will remain? 12 days. So it tells you, because some women will be thinking it must be 14th day. I must have my distance 14th day. I must have my ovulation 14th day. No, I told you, people that run that with 8-day cycle, the women is just about 35%. 35% is just like you have 100 women, 35 people at once having it. What of the remaining 65%? So it guides you. And let me use this opportunity. Any woman that is trying to conceive, you should have at least your phone. You should have a place where you can be writing your menstrual cycle. That's your LMP, last menstrual period. Then we are not interested in the day it stopped. We are just interested in the day it started. You understand? With that, the doctor can help you calculate your cycle length. With that cycle length, we'll be able to tell you, madam, you will ovulate on so day. Like if, from what I've said now, if for instance, you are among those people that have 28-day cycle, what it means is that then you remove 14 days for your luteal phase. What is remaining is 14 days. That means you are going to ovulate on 14th day. So having sex around that 14th day helps you to conceive. Then if you're a woman, for instance, that is running a 21-day cycle, for instance, you remove the 14 days, which I told you, that one is constant for every woman. Is irrespective whether you are running 21-day cycle, 22-day cycle, 23-day cycle, 35-day cycle. All we are interested is the luteal phase is constant. Luteal phase, I've told you, is from the ovulation to the next menses. That one is constant. So if a woman is running 21-day cycle, for instance, then you remove the 14 days for the luteal phase. What remains here is 7 days. 7 days remaining. Now, these 7 days remaining, that means she's going to ovulate on the 7th day. So, and how do you count it? You count the first day I told you, the first day blood start coming out, your period starts. That first day is your first day of your new cycle. So that day you count it as one. So for that woman that is running 21-day cycle, for instance, you have removed 14 days for the luteal phase. What is remaining is 7. So that woman is planning around 70 days of her cycle. But if you don't have this knowledge, you still be planning around 14th day. You start preparing yourself to have enough sex around that time, when actually your ovulation has come out. Thank God. You see the thing. So with this, if there are other confusion, let us know. Drop your comment on the comment section. You can also chat us privately for us to give you. Remember what I said? I said this thing does not prevent you from seeing your doctor. It's just a way of enlightening the public for educational purposes. Please remember to like, subscribe, share for others to learn, so that they will know that inability to conceive is not a spiritual thing. You don't need to blame your mother-in-law or your father-in-law. You blaming your mother-in-law, very soon you become a mother-in-law. Thank you. See you in the next video. Thank you.
Fertility and reproductive health platform remains the platform where you will be taught for free how to conceive. successfully, then deliver successfully. Remember to like, remember to like. Remember to like, comment, subscribe and share for others to learn. Remember to like, comment, subscribe and share for others to learn. A free space for knowledge where life begins anew. With love and guidance, we'll walk this path with you. From the very start until your joy is in your hand.